Good afternoon, everyone. All right, I've got you. Welcome to the 2018 Congressional Black Caucus Health Braintrust Awards Luncheon and Town Hall. My name is Brandon Webb. I have the honor of serving as the Chief of Staff to Congresswoman Robin Kelly of Illinois, the Chair of the Congressional Black Caucus Health Braintrust. Yesterday's portion of this conference was phenomenal, and I hope that you all are enjoying today's session as well. Today, we look to continue fueling the debate, inspiring the ideas, and advocating the actions that will help us close the health disparities gap that plague this nation. But before we do that, we want to take this time to feed your mind and body, and that would not be possible without the sponsors of this NMQF conference. So let's just take a quick moment to thank them. And now we will honor a few of the strivers, the dreamers, and the leaders who have been on the front lines of the health equity crusade as we present 3 awards. The Chairwoman's Congressional Leadership Award, the Outstanding Corporate Leadership Award, and the Chairwoman's Congressional Staff Leadership Award. And we're going to go a little bit out of order from what we initially had. The first award that we will be presenting is the Outstanding Corporate Leadership Award, and that will be presented to Ashli Palmer of CVS Health. Now, Ashli is the Director of Federal Government Affairs for CVS Health. She is the lead House Democratic lobbyist for the Fortune 7 company. Most recently, Ashli served as the Policy Director for the Office of the Assistant Democratic Leader, Congressman James E. Clyburn of South Carolina, the 3rd-ranking Democrat in the United States House of Representatives. She also worked in the Obama administration at the Department of Agriculture as the Chief of Staff to the Rural Business Cooperative Service Agency and as a special assistant to the administrator in rural housing. She began her career in Capitol Hill in 2002 in the office of one of my favorite Southern Democrats, John Spratt of South Carolina. Ashli holds a bachelor's degree in English from Spelman College and is a native of Columbia, South Carolina. She lives in Washington, D.C. with her husband and 2 sons. Congratulations, Ashli.
I am so honored to be standing here today to receive this award. Thank you to Congresswoman Kelly and your fabulous staff, Brandon and Mia, for this recognition. I've spent most of my career, as Brandon said, fighting the good fight as a staffer on Capitol Hill, and now that I'm in the private sector, I'm very proud to work for a company that's committed to improving access to health care and helping people on their path to better health. So thank you so much. Thank you so much.
All right, congratulations again, Ashli. Our next award, the Chairwoman's Congressional Staff Leadership Award, goes to an amazing individual, Caren Street, who is leading the policy charge for the Congressional Black Caucus under the direction of its Honorable Chair, Cedric Richmond of Louisiana. Caren is the Policy Director of the CBC, and in this capacity, she supports the legislative efforts of each of the members of the caucus and advances the Chairman's agenda for the 115th Congress. Prior to joining the CBC, Caren worked for former Senate Democratic leader Harry Reid for almost 9 years, most recently serving as the Senior Policy Advisor for Business, Economic Development, and Labor issues. Caren began her Hill career as an intern on the staff of Georgia Senator Johnny Isakson, Caren is a product of the other HU, Howard University, and earned her law degree from George Washington University at night while working full-time. She hails from Stone Mountain, Georgia, and is a long-suffering Atlanta Falcons fan. May your struggles continue. Congratulations, Caren.
Thank you so much.
There's always another Super Bowl, so we still have hope. Thank you so much for this honor. I've worked on the Hill for over 10 years, but never have I worked with a group of just outstanding just champions for health equity in my capacity as policy director for the CBC. I just want to thank Congresswoman Kelly, your amazing staff, but also there are really countless staffers on the Hill who are fighting this fight. They've been fighting this fight long before I got to CBC, and they will continue it long after I leave. And so I really just want to accept this award on their behalf. So thank you.
And as everyone knows, our members of Congress, they have a lot on their plate, often pulling double and triple duty. And we are awarding the chairwoman's Congressional Leadership Award to the Honorable Stacey Plaskett of the U.S. Virgin Islands. And like I said, members are doing double and triple duty. Ms. Plaskett has mastered the art of trilocation. So she is taking her meetings, doing her hearing work, and somehow she's here at the same time that all that's going on. So we appreciate that. And here to introduce the Chairwoman's Congressional Leadership Award, Congresswoman Robin Kelly of Illinois.
Thank you.
Thank you so much, Brandon. Congresswoman Stacey E. Plaskett is the at-large delegate to the U.S. House from the United States Virgin Islands. She's an attorney and has practiced law in New York, Washington, D.C., and the U.S. Virgin Islands. Ms. Plaskett has thorough knowledge of economic development and public-private partnerships for growing the Caribbean economy in developing areas. Serving her second term in Congress, Congresswoman Plaskett is a staunch advocate for poverty reduction, equal voting rights, and has since inspired a new national conversation on poverty and voting rights in the U.S. territories. Congresswoman Plaskett is a member of the House Committee on Agriculture, the Committee on Transportation and Infrastructure, and the Committee on Oversight and Government Reform, where we make faces together. In addition to her official committees, Ms. Plaskett sits on several congressional caucuses, serving as the co-chair of the Congressional Caribbean Caucus and a member of the Congressional Ports Caucus, among others. Since taking office in January 2015, Plaskett has embarked on several legislative initiatives aimed at improving the economy of the U.S. Virgin Islands and underserved communities by creatively utilizing public and private programs through infrastructure development, educational support, and social impact investment. She is also a strong advocate for our service members and recently introduced legislation that will help returning veterans secure employment. Congresswoman Plaskett has worked fiercely in the wake of the two devastating hurricanes to rebuild the Virgin Islands and make them whole again. She has worked with local governments and affected populations to restore infrastructure and provide critical health and humanitarian services. When I think of Stacey, I think of this keychain that I got for her. Well-behaved women seldom make history, and that is Stacey so much. And we're also sisters in another way. We both represent what we represent, but we both grew up in New York, so we have our New York meetings too. But congratulations, Stacey. I'm so proud of you and well-deserved.
Good morning, everyone. Thank you all. I had the pleasure of meeting so many of you yesterday evening for the lively discussion we had. And I'm so grateful for the opportunity to be here with you in the discussion on bridging the equity gap and achieving sustainable, healthy communities. You all are doing fantastic work in that area, and we're all really grateful. It's an honor and a pleasure to receive this year's 2018 Distinguished Chairwoman's Outstanding Legislator Award from the CBC Health Braintrust, particularly moving for me since my predecessor and a mentor and someone that we all in the Virgin Islands look up to, Congresswoman Donna Christensen, is one of the founders of the CBC Health Braintrust. I first want to thank my friend, my colleague, and as you've heard, my sister and fellow facemaker on the Oversight and Government Reform Committee, Congresswoman Robin Kelly, for your steadfast leadership, your support of healthy communities, and also for speaking out so vocally on communities that do not have a voice in the areas not just of health brain trust, but of violence in our communities as well, and being really, in my mind, at the forefront of gun violence in the United States. I want to thank you for that work. And next, I'd like to thank Gary Puckering of the National Minority Quality Forum for your hard work and the work of the organization when it comes to assisting healthcare providers, professionals, administrators, researchers, policymakers, community, and faith-based organizations to come together in a word that was used last night in the intersectionality for the healthcare for minority communities. Thank you all so much and look forward to working with you all.
And thank you, Congresswoman Plaskett. Let's give her one final round of applause to all the awardees this year. Now, we will be moving on to the town hall portion of our program, moderated by Mr. David Johns, for a conversation on sex, drugs, and violence, reducing risky health behaviors in young adult years. Great lunchtime conversation. So, David?
Yeah, appreciate that. I'm going to invite the panelists to join me on stage as they come and take their seats. Also want to highlight that you all have some framing for this conversation in your programs. A part of ensuring that we build healthy communities, ensuring that we cover the gap for our children and youth. And so we're going to take this opportunity to be really intentional in talking about not only the challenges, but opportunities to shore up gaps for our babies. No. Stand so that I can see the rest of the room. So for those of you who I have not had the pleasure of meeting, my name is David Johns. I started my career in DC on Capitol Hill serving as a CBCF fellow. So in the spirit of Aunt Maya, who will acknowledge that most of you are going to forget what I'm going to say, hear me when I say thank you. Thank you first to Congresswoman Kelly. Thank you second to all of the staff that work on Capitol Hill, in particular those of us who don't get paid equitably. And thank you to all of you for doing this work. So really quickly, 3 data points that I want to introduce. More than 60% of youth have been exposed to crime, violence, or abuse. That's 60%, more than half of them. 25% of youth were victims of a robbery or witnessed a violent act within the last year. And nearly half of all children and adolescents, so the young people that we are talking about and centering now, were assaulted within the past year. And what we have to acknowledge is that there are significant adverse experiences, especially for young people at this point in which they're developing not only cognitively, but as well socially and emotionally. And so it's really important to note that people who experience the types of trauma that we're going to spend a little bit of time going deeper and discussing are 15 times more likely to attempt suicide, 4 times more likely to become an alcoholic, 4 times more likely to develop a sexually transmitted infection, 4 more times likely to inject drugs. And I could go on and on. The point I'm making is that there are real determinants and real implications of our young people experiencing violence and trauma. And so I want to first invite into this conversation Dr. Nadine Richardson. She's going to introduce herself, and in that context, I've asked her to talk about what's the single most pressing health disparity facing young adults from your perspective.
Sure. Good afternoon. My name is Nadia Richardson. I'm the founder of No More Martyrs Mental Health Awareness Campaign, where we seek to build a community of support for Black women. And we also have a signature event, which is the Minority Mental Health Awareness Summit, which takes place in July in Birmingham, Alabama. So this will be our third summit taking place this July, July 12, 2018. So as far as like a single disparity, it's kind of difficult to just hone in on one single disparity. I will say, just in regards to our youth, thinking about preventative mental health care is a dynamic kind of a concept. Because a lot of times when we're thinking about mental health, we're not thinking about it in relation to social determinants of health. So for example, in some of the statistics that you mentioned, when I'm thinking about preventative mental health, I'm thinking about the amount of violence that youth are exposed to. And the fact that that is leading to a rise in PTSD, which is something that we've never really considered before. So when we're talking about preventative mental health care, we're also talking about environments, we're talking about communities, we're talking about job access, we're talking about school equity issues, we're talking about a number of different things. These things, we have to create environments that are going to lead to healthy mental health considerations for young people. So really thinking about it in those ways, and not just in regards to what is the one overarching disparity. The fact is there are a number of different disparities that exist that are contribute to the persistence of our ongoing mental health disparities.
Appreciate that. And so we'll come back to this as well as in the focus on creating environments and what's required in order to do that. I want to tap in Anthony, who's with Cities United. If anybody's on social media tweeting, his handle is @Cities United. Nadia's handle is No More Martyrs. There's an underscore between no and more martyrs. But Anthony, would you answer the question as well and then talk about it from an environmental perspective?
Again, thank you all. Anthony Smith, Executive Director for Cities United. We support a network of mayors across the country who have committed to work with their communities to really create communities that are safe, healthy, and hopeful for all of our kids, but really focusing in on how we reduce the homicide rate of African-American men and boys ages 14 to 24, and really trying to make sure that those young men and their families are at the table helping us identify solutions and really looking at how we move forward as a city, not just a city government, but as a collective. And I think when we think about the environment, I think Nadia hit it right on the head. I think one of the issues that we got to really think about is when we're talking about youth and violence, we also got to talk about their parents and their families and really create a system and an environment where we're helping families get access to those resources and making sure that families are stable so that our kids can have better outcomes. So I think when we all start this work, we usually go right to the young people, but we forget those young people got homes that they got to go to. And most of the time, those homes are not as stable as they need to be because they're might be homeless, sleeping from couch to couch, and don't know where their next meal is going. So I think part of the environment is that we got to look a little bit more holistic and think about how we bring mom and dad into the conversation, and grandma at times, and think about the kid as a whole, not just that when they're sitting in front of you.
So I hear we're building upon this idea of understanding that our young people need to be in spaces where the people around them and the institutions that support them or that they pass through are responsive to the things that they are experiencing in life, right?
Yep.
I want to invite in Charley to talk about how it is that you and Walgreens are helping to fill some of those gaps, in particular in communities where people might not have access to the kinds of conversations that we're having or the kinds of resources that are needed to respond to this trauma that our young people are experiencing.
Thanks, David. Good afternoon, everybody. Great to be here. My name is Charley John. I'm the Director of U.S. Public Policy for Walgreens. Before that, I was a pharmacist for our company and oversaw some of our pharmacy operations. So I'll try to tackle that question maybe from both perspectives. First, as a pharmacist provider, I've practiced pharmacies in communities of all sizes, backgrounds, means, healthcare access. What struck me kind of along the way in those areas is sort of this general lack of perceived value of healthcare. Our young folks not thinking that it's important to address health if, simply put, they feel okay. Or not thinking that conditions like diabetes or hypertension, ones that we know are so prevalent amongst minority populations, that those often start because of foregoing basic health services. So I think pharmacies can really play a role in addressing and increasing awareness around those things. Pharmacies are the essence of preventative care. Well beyond dispensing medications, pharmacists provide life-saving immunizations. We perform health risk assessments. We optimize medication use and incorporate adherence programs. We offer therapy and treatment counseling, including the use of over-the-counter medications, so it can stave off the progression to like an ER visit or a doc visit. And so these are the things that are certainly lacking in the community. We know that the young adult population and the minority population, they of course experience things like not having access to a primary care physician, lack of insurance coverage or limited insurance coverage, churn, other social determinants of health that don't favor healthy living. So pharmacists can really come in to sort of bridge those gaps. 93% of Americans live within 5 miles of a community pharmacy. So I'd say that's pretty impressive access. I would say our young adults are not really connecting that pharmacists can bridge those gaps of care, and that is sort of where some of the public policy deficiencies do exist. I know best that utilizing the pharmacists to the tops of their capabilities and involving them and integrating them into the healthcare team is not where it needs to be. And so to address these gaps that exist in care for young adults, public policy needs to move forward to recognize pharmacists more and get them more involved in the delivery of healthcare.
I appreciate that. We're going to tap in Ulysses. I mentioned to you all that I started my career in DC working on Capitol Hill as a CBCF fellow. What I didn't share is that previously I had the pleasure of serving still my forever president, Barack Obama, as the executive director of the White House Initiative on Educational Excellence for African Americans. We were charged with finding ways to center and celebrate the experiences of our young people. Of course, I'm still recovering from the trauma that is our current situation. And I've sought refuge in an organization called the National Black Justice Coalition. Y'all sitting with that because y'all dealing with the same trauma. I get it, right? We'll talk about that too. But the National Black Justice Coalition, for those who do not know, is our nation's only civil rights organization, both intentional and unapologetic, at sitting in the intersections of civil rights and LGBTQ equity. And I said that, thank you, I appreciate that, because I want Ulysses to talk in particular about one of the things that affects not only African Americans, but LGBTQIA, same gender loving people, but youth as well, and that's HIV, right? So to be clear, I want you to talk about that as a social determinant, and in particular how it's affecting our young people, but also want to make space for you to be able to connect that to the larger health determinants that we're talking about as well, right? To be clear, African American young people are not engaging in more risky behaviors. They are not predisposed to do things that other people are not doing, but there are conditions that make it such. So I want to invite you and Ulysses to connect those dots for me, please.
To remember a friend, a brother, and a colleague to all of us, Dr. Timothy Cunningham. Dr. Cunningham was a commander in the United States Public Health Service and a CDC epidemiologist. He went missing over 2 months ago, and his body was found over 2 weeks ago. And the work that he worked on was the conversations that we were having just here, health disparities, particularly among communities of color. And so, if you will, I'd like to have a moment of silence to remember him and his work. His death is a tremendous loss to this community, and I would like to honor him in that way. Thank you. To your question. Again, my name is Ulysses Burley. I am the founder of You Be the Cure, which is an organization founded at the intersection of health and human rights with a particular focus on HIV and AIDS. During my training, I spent a year in Argentina where I worked with the Fundación Webb, which was the principal HIV and AIDS foundation. And in the midst of treating HIV and AIDS patients, one thing was clear. All of them had a diagnosis of HIV, but all of them had found their way into the hospital under different social circumstances, whether it was substance abuse or violence or poverty or government corruption or discrimination, racism. All of them had a story, a backstory behind their HIV diagnosis. And so it was during this year that I began to be challenged by what it was that I was to do as a clinician to help deal with the social determinants of health, because I understood that no matter what I did for my patients in the hospital, I would still send them out into a world where they would experience poverty, violence, discrimination that would then lead them back into the hospital for something else. And so I founded this organization, You Be the Cure, to address those social determinants where we treat people and not disease. The idea is to really acknowledge the whole person. A lot of times when we talk about health, we restrict health to being below the head and above the navel. Quite frankly, mental health is a part of our whole health and wellness. Sexual and reproductive health is a part of our whole health and wellness. And when we talk about young people, most of their health issues take place above their neck and below their navel. And so we do a disservice to young people, particularly LGBTQ youth who are faced with high risk for HIV infection and a number of other social determinants. But what we really do is we try to focus on the issues upstream to prevent the issues downstream. And so before my experience in Argentina, I wanted to cure disease. I wanted to cure HIV. When I left Argentina, I wanted to cure poverty. I wanted to cure violence. I wanted to cure discrimination, because in doing those things, I think we would then be able to prevent diseases like HIV and AIDS. And so my comments today will be focused largely around youth, LGBTQ youth in particular, the HIV epidemic, and how it is we can impact these social determinants upstream so that we can prevent HIV infection downstream, and so that we can continue to serve those who are living with HIV.
I want to invite you to do that, but before, Nadine, you mentioned PTSD and young people, and when you mentioned it, I thought about the experience of watching hundreds of black kids walk out of Northwestern High School protesting the fact that they have had 4 friends, classmates who have been shot this year. I thought about the March for Our Lives and watching young people take up space in that way. And while we often celebrate them in those moments, we don't sit and spend similar amounts of time thinking about the trauma or what causes them to show up in those spaces. So can you just unpack a little bit more about the PTSD that young people are experiencing, and then talk a little bit more about racial fatigue syndrome as well?
Sure, absolutely. I think when we're talking about PTSD, again, there's this misconception that it is tied directly to warfare, right? But we know now that that is not the case. But I also want to really focus on the idea that it does, research-wise, it's been proven that it can actually be written into the DNA, trauma being passed down from generation to generation. So this concept of PTSD, post-traumatic slave syndrome, racial fatigue syndrome, it really came out of research that explored what that looks like in descendants of the Holocaust. And the fact that that kind of trauma can be passed down from one generation to the next generation to the next generation. We're seeing it now more so in regards to exposure to police violence videos, right? So this idea now that you can actually experience that from the violence you're seeing in your community, but also the ongoing, those videos that loop. One of the things we say with No More Martyrs is that you don't have to watch to be woke. Because when a police video, shooting video comes out on our online engagement might jump from 25,000 to 500,000 in 24 hours of individuals who are saying, I'm stressed, I'm scared, how do I go to work? How do I engage individuals that don't understand what this means to me? And so for young people, and I've had the opportunity to do some consulting with universities more so, trying to engage students and understand what this anger is, this anger, how do we understand this anger? I actually encourage that activity of activism. They need that outlet. They need to feel as though they're being heard. They need to understand that to keep it inside, when we're talking about, for example, Black Lives Matters, a number of Black Lives Matters activists have been lost to suicide, right? So there's this, there's suicide, there's activism burnout, but there's also this idea that if they're not involved in that kind of activism, what is being done in regards to how they're being able to process this environment of racial fatigue. So it's actually a healthy outlet for them to have that kind of involvement, but also for us, as far as social determinants of health, it's not up to those who are experiencing the trauma to be always the problem solvers. We need allyship. We need individuals to understand that these things are embedded into many of our institutions. They don't just start in the tail end of violence. They start in school systems. They start in job access. They start in economic equity issues. They start in healthy access to healthcare issues. It's all related. It's all connected. And the PTS is just the tail end of it. It's the result.
So Ulysses, can you do what you said you would do and go deeper and really talk about how it is that we can do a better job of showing up as allies with and in support of our young people? And then after you do that, Anthony and Charley, I'd like you to respond similarly, but acknowledging connections to not only parents and families, but communities as well.
Absolutely. So, today we've made tremendous strides in HIV and AIDS science. To the point where we can consider it a chronic disease. Today, the issue is access and stigma. Stigma. I think stigma now kills more people than HIV and AIDS does. And so how do we impact that stigma? Well, first and foremost.
Can you say that last part again? I want everybody to have heard that.
Sure. Stigma kills more people than HIV and AIDS does today. And so HIV-related stigma, LGBTQIA-related stigma, and so when we think about the numbers, young people ages 13 to 24 make up 1/5 of all HIV and AIDS cases in the United States. 1 in 7 of them do not know their status. Majority of the cases, 80% of the cases, are between the ages of 20 and 24. And then we dig even deeper, 81% of those cases are among men who have sex with men. And so we talk about a number of different factors that come into play: sex and sexuality, infectious disease, but also these social determinants like homelessness and violence against LGBTQ persons and discrimination, not only by family members, but by our government of these very individuals that then lead to what we call risky behavior, drug use, risky sexual behavior, and things of that nature. And so I think in terms of allyship, all of us can cure HIV and AIDS if we are able to treat people living with HIV and people who are at greatest risk for HIV infection, particularly young people, with love, care, compassion, and dignity, right? You don't need to be a physician or a researcher to impact HIV and AIDS because stigma kills more people than HIV does at this point. And so one of the things that we try and do is to really advocate for the LGBTI community in faith spaces, in the biomedical community, in government, and other civil society agencies, because we feel like if we can affirm these young people in their sexual gender identities, then we can further impact the HIV and AIDS epidemic among young people in a positive way. And so, when we talk about sex, drugs, and violence, and then you couple that with LGBTQIA and young people, just that in and of itself and alone is very stigma-laden. But then when you break it down and you talk about violence among LGBTQIA people, and you think about the origins of the LGBTQ pride movement, if you remember, LGBTQ pride was birthed in response to police abuses against the LGBTQIA community. And I think often we don't define police brutality as violence. And so when we talk about state-sanctioned violence against black and brown bodies, when we talk about state-sanctioned violence against sexual and gender minorities, that's violence as well. We talk about profiling and things of this nature. These are all things that young people, particularly young people of color, LGBTQIA or otherwise, have to deal with, not only from the system, but interpersonally at school, their families, their faith spaces, and all of these things lead to these high-risk sex behaviors, substance abuse, mental illness, and otherwise. And so, many of us in here, physicians, clinicians, policymakers, we all have a role in curtailing this HIV and AIDS epidemic just by simply showing compassion, showing dignity, showing love to those who are at greatest risk.
And both of us have used a number of acronyms differently at different times. I don't want to make any assumptions, and so we'll just run through. L is for lesbian, G is for gay, B is for look, some people don't know.
Right.
B is for bisexual, T is for transgender, ER, not ED ever.
That's right.
Right? Q, sometimes depending on where you are, is for queer or questioning. Right? I, intersex, what we have sometimes referred to incorrectly as hermaphrodites. A, asexual. Sometimes there's a P for pansexual, and what we now do is add a plus at the end because things are often created as they're necessary.
That's right.
You also heard me say SGL, which is the acronym for same gender loving, a term that was created by Cleo Monago to acknowledge the importance of being both Black and same gender loving, period. So invite you to use those as you go forward. Can we just continue in that regard and again talk about connections not only to parents and families but to communities?
Yeah, and I think, there's a couple of places that I think we, to Ulysses' point, we could show up and be helpful and helping kids process. Because I know when you talk about the young kids walking out of school because they lost 4 friends, most schools don't provide support when that happened, right? There's not mental health folks at the school when those kids come back to school from the weekend or the day, but we know they do it around mass shootings. And we know some schools are getting better when they do it around suicides. But when it comes to the number of young Black men and boys that we lose to gun violence in the streets, there's no real support that happens in the school, and it happens when they come back. But also, when I go to funerals of young people, there's more young people at those funerals than there are adults. And all of those young people are trying to process that and trying to figure out how do they move forward? How do they mourn their friend but also move ahead? And I just don't think we show up in places like that. And I don't think we as a community support our young people in a way that helps them process that. And I know there's and also when we talk about what's working and how people are showing up, there's a hospital-based intervention strategy that a lot of people are using around the country, where it really is when a young person comes to the hospital with a stabbing wound or a shooting wound, there's some interrupters or some folks who can help kind of really de-escalate. Because you got a bunch of folks at the hospital who are upset and trying to go retaliate, but you got to have folks who can work in partnership with the hospital and in partnership with the police to really de-escalate that stuff, but then start working with the patient to say, how do we help you not return? And how do we help you not shoot anybody and end up in jail? And really create a long-term plan and strategy, right? So I just think there's some simple ways that we could show up, and then we could be advocating for our school systems to do better, because our data shows that we lose 7 young men every day between ages of 14 and 24 to gun violence in the streets. And we're not really showing up for their families and at the school system to support their friends. So I think those are kind of some of the things that we can really do when we start talking about trauma and how do we help folks start the healing process. Where do we show up and how do we show up is really important to the process.
Sure, and I'll add to that. I think I want to make sure that folks know that there are frontline providers that are available, that are accessible, and they can truly help. I was just having a conversation with Nadia before. She works on mental health, and we have a mental health platform at Walgreens. And it was important to discuss that you not only need to be a mental health expert, but you have to understand what it means to be female versus male. You have to understand what it means to be a different race or where you live and things like that. And those are the aspects that community providers like the pharmacists at Walgreens and other pharmacies represented here have been really dedicated to making sure that their pharmacists can adequately help these patients. In thinking about what Ulysses described, we have had very robust programs around sexually transmitted diseases, including HIV, hepatitis B and C, chlamydia, gonorrhea. We have testing services for folks. We have referrals to treatment, and we have basic counseling. And one example I'm really thinking about, we have what we call specialized pharmacies in several disease states, HIV/AIDS amongst them. I believe we have close to between 800 and 900 locations across the country where our pharmacists and our technicians and other personnel are specifically trained in this aspect. When I was a pharmacist, I worked at one of these locations, and it was amazing to me that when folks came up to have their conversations about the medications, and first of all, this was now 10 years ago for me, the hesitation in them wanting to talk to us and ask questions and learn about things. But what was really stunning is that most of their questions were really not about the pharmacology of the medications or adherence schedules or things that pharmacists are traditionally used to counseling patients on. It was really about these other social aspects that prevented them from optimizing their therapy. It's not being able to afford the medications. It's what do people think about me being on these medications. It's other things about reducing risks in your lifestyle that we thought were taboo to talk about. But we really need to get these things out in the open, and pharmacists are available and these frontline providers are available to have those conversations. I think it's pretty amazing that when I first started with it, sometimes we would communicate with cards, because we acknowledge that folks might be hesitant to talk about it, so that we may present them with a card with simple instructions, and they may communicate to us only when they got back home and on the phone. Fast forward this many years later, I really see a lot of that being broken down, where folks are ready to come and talk to us and have these conversations, learn more about those conditions, and know that it's a regular disease just like the diabetic person or the high blood pressure patient that walked in just in front of them. And if we start to treat those diseases in the same way, one of the areas, and we'll probably get to it in a minute, but we have a lot of focus around the opioid crisis, and we're seeing the young adults more and more becoming swept up into that crisis. A lot of times it simply starts, the story, get a prescription for a simple injury. Pills are taking longer than they're needed. Pills remain in the home, and the rest is history. And the prevalence of opioids in these young populations, and even worse, the transition to now heroin and the introduction of synthetic fentanyl, leading to the dramatic rise in overdose deaths. We are committed as a pharmacy community to providing solutions for that. We have installed safe medication kiosks, receptacles where folks can come and easily and safely dispose of their medications, get them out of the house. We've done that in 1,500 locations. Many other pharmacies have followed suit and done so. We're providing naloxone at our pharmacies, an overdose antidote to folks, making it easier for them to get it. You all have likely read the Surgeon General's recent advisory on the importance of naloxone and how important it is to make it available and easier for people to access. And we've committed to that. Many times life and death is separated by the availability of naloxone. So being available at a pharmacy, being able to get that without a prescription, consulting with a pharmacist has really made a lot of difference. And our young population is especially vulnerable to this crisis. We need to help them out. We have actually further supported and strongly supported the campaign It Ends With Us, where we're providing teens with resources and ways to prepare their communities for healthy living and addressing the opioid crisis.
I appreciate that, and again want to just thank the Congresswoman and her staff for making space for us to talk about young people. I would ask that the next time we do this, we consider inviting in a young person to engage in this discussion as well, but want to say thank you for making space for us to be more thoughtful about them. In that regard, before we open it up to questions and interventions from the floor, I want to ask each of you to channel the young people that you do your work on behalf of, and to offer up and ask, what's the intervention that you'd like for everyone in this audience to consider, given all that we've talked about thus far and all that you know that our babies need?
Sure. I think an ask of us as professionals would be to reconsider what we mean by preventative care. A lot of us had the opportunity to see the Surgeon General speak yesterday, and he shared a personal story about his brother being in prison, and he talked about the amount of money, the cost to taxpayers for him to be housed in jail versus preventative care for him to maybe not have access an illegal substance to manage his own mental health concerns. And so an example for No More Martyrs, we're a national organization but founded and headquartered in Birmingham, Alabama. And there's two communities, Birmingham or Bessemer, Alabama, and Hoover, Alabama, two suburbs of Birmingham. One affluent, one not so, one predominantly white, one predominantly black. Both of them like one exit up from each other, but the life expectancy of Hoover is much higher than Bessemer. And the school systems, the opportunities for young people, the high levels of policing in Bessemer, the lack of job access, and so access to economic advancement, those things all of that impacts the mental health of young people, and they see it. And if you have the opportunity to engage them, many of which end up in the juvenile system, they understand this and they internalize it. And so their self-esteem is so incredibly low. And then when you do have the opportunity to engage them, just like you mentioned earlier, their families need access to this care. So how can we increase access to mental health services to families, which is going to have an overall impact on young people? Another ask for us, I believe, is for us to, we've done a very good job of talking about social determinants of health. I think we need to maybe do a better job of having the more difficult conversation of what informs the persistence of those things. And a lot of that has to do with us being unapologetic in regards to having the conversations about how history contributes to social determinants of health. For example, in Birmingham, redlining, the fact that property tax has a lot of remnants of Jim Crow and segregation embedded into it. So our institutions, all of that contributes to how our schools are funded. All of that impacts access and opportunities for our young people. But we don't address that. We don't get to the core of that. And if we don't get to the core of that, then we're not able to actually recreate and reform some of those institutions in the ways that they need to be. We are actually, that's a part of the preventative health care that we need to do as well. And we need to have those important conversations. So those are two of the things, kind of re-envisioning what do we mean by preventative care, and not being afraid to have those conversations beyond just an understanding of what the social determinants is, but how our history of inequality is embedded into why those things are not going away.
I hear now Iyanla in my ear saying, call a thing a thing.
Yeah, right.
And the importance of naming things like race and racism and anti-Blackness and how that's contributed to all of this. Ulysses, same question. What's your ask? What's your charge?
Sure, really it builds on what Nadia mentioned. Consider the social determinants of health in all that you do. If you're a clinician, consider the social determinants when treating people living with HIV, particularly our youth. Offer trauma-informed care. Understand that these young people come to you, perhaps already have been hurt, have experienced a significant amount of trauma over their lifetime. And that trauma, that history informs how they present medically. And so my ask to clinicians are to offer trauma-informed care, understand that people are not just their diagnosis. As yesterday, one of the common themes was putting people before their illness, and then use that information to then proceed in how you care for their patient too. To those of you who are in politics, who craft policies and things of that nature, consider the social determinants of health in those policies that you craft. Consider these young people, what they've been faced against, the systems that have been historically against them. And consider those things when you craft your policies. Community leaders and people of faith, consider the social determinants of health when you do community outreach in your theology, in who you damn to hell and who you deem worthy to be saved into eternity. Consider the social determinants of health, people's history, people's backstories, and how society has contributed to what manifests in our bodies medically. To educators, we talk about sex, drugs, violence. Sexual health education is on a decline in this country, has continued to be. The research shows that the sooner young people are educated about their sexual health, the more likely it is that they would abstain from engaging in sexual activity. But yet we're going a different direction, right? We're offering less of that. And then when we talk about key populations for HIV infection, like men who have sex with men, there's nearly no sexual education for these demographics. And so consider this, consider the social determinants of health, consider how we are equipping our young people when they present to us in these challenging situations before we pass judgment, before we deem them as unworthy or marginalized people. We really need to humanize all of those that we serve in the work that we do, view them as people and not as their diagnosis or their disease.
Charley, same question to you.
Sure. I think it's important for, I imagine in this group there are many parents of young adults, there are mentors of young adults or teachers of young adults, and then us who work with young adults. Let us make sure that we stress within young adults the importance of health. Make sure that they take it seriously. We bring our kids up and We ensure that they know it's important on certain values in this world, how it's maybe important to go to school, go to college, and all those types of things. I'm not sure if we apply the same attention to them thinking about their health. So they sort of think that it's just this other thing that I'll kind of worry about, or when something comes up, that's when I take care of it. And that's not how you address something from the beginning and lead a healthy lifestyle moving forward. So I would really encourage us to be very, very stressful to our kids and our young adults about the importance of healthcare, getting your immunizations, getting tested, things like that. And if it's instilled in them that it is very important, they're going to do it. Funny story, and maybe I'm just trying to sneak in a story about my cute kids, but my older two kids are 6 and 4, so they are in the thick of immunization schedule, right? So maybe about a year ago or so, when they were probably the first time that they understood that they're about to sit there and get the needle stuck in. Because before it was just like looking over here and then they get stuck in. But they were sitting there and they knew that it was going to happen. Before we got there, I said, look, this is what's going to happen. You're going to get a needle injection. It's going to hurt for a little bit, but you're getting an immunization. It's going to make your body really healthy. And they got super excited about it. And they were ready to go the next day. They sat down. They put on this brave face. I'm telling you, it was amazing, and my children are convinced how important immunizations are. So I think as parents, as educators, as pharmacies and frontline providers, we need to do that. And if they take it seriously, the actions that they learn as kids are going to translate into their behaviors later on. So let's do that. And as we translate that into public policy, let's make sure we're not so reactive to everything, that everything isn't like, oh, a problem came up, let's fix it. This disease comes up, now let's just figure out a way to, let's have this holistic approach that knows to look for the unintended things that happen, address them all together so that we're not having people fall through the cracks.
Yeah, I think the two asks for the young people that I work for would be, one, spend time telling your story and being transparent. Our young people believe a lot of us in this room just magically appeared at where we are and don't see the pathways and the mistakes and the bumps and the third and fourth chances that we got to get to where we are. And I think it's important for us to really tell those stories and really go back and do that. And I think it's also important for us to use our positions of power to create pathways for these young folks too. So when are we advocating for them? When are we opening up doors for them? And when are we making sure we're saying to them, this is the way to go? Because I think a lot of times we just assume, they're going to get what they get. And a lot of times folks think our young people just are not working hard, but they're really looking for opportunities, and they're really looking for us to help them find those opportunities. So time and transparency, but then also using your position of power to create space for them to achieve their goals and their dreams.
There are, I see 4 people in line at the mics, and I want to make sure that we manage expectations going forward because time is the most precious resource. You can't get it back. I don't want to be respectful of that. So I'm going to ask that we take the 2 questions, and then I will offer an opportunity for you to respond. And I emphasize questions, which usually begin with prepositions, who, what, where, when, why, and how, to say that if you offer an intervention, I will cut you off with love. So let's start here, and then we'll come here.
You're going to cut me off before I start. I do want to say thank you to the panelists. I commend you for coming outside of your box of professional training and trying to reach out to the community. And some of the challenges that we see, that I see as an officer in uniform, as an African-American female clinician, are that some of our children don't get what they need to get at home. So we are in a position to provide that care. I love what he said. Care, compassion, and dignity. That begins early. We have to get them early. And how we can do that is by any means necessary. When you go to funerals and support these young people, by being there and present, you're communicating with them. I'm trying to tell you how we can do what needs to be done, because there's so much to be done.
There's no question.
There's a statement and then a question.
Okay, then let's take the questions.
The question is, can we come out, everybody come outside of their box to reach more, to be more involved in the collaborative practice, because we can do it, but we have to do it as a group.
Got the question. Yes, ma'am. Can we come out of our box, or maybe how?
I have a question, but I have a statement as well.
Do you have a question behind her? Does anybody have a question? No, let me just see if she has a question.
Well, thank you all. And my The question that I have relates to the fact that these youth are experiencing valid, legitimate pain and going through chronic traumatic stress, but we're not calling it that. Do you believe that it's appropriate, as you said, to call a thing a thing? So as opposed to saying they are angry, which I hear from our community, multiple community, the police, everyone calling it anger, do you believe it's appropriate to call it what it is, pain? These people appear to be suffering, and kids I talk to are suffering. They feel pain. Yep. Would it not be appropriate to call
Nadia,
it?
why don't you start?
To speak to some young people last weekend at a youth summit, and I was asked to come in and speak about implicit bias and police interaction. And we absolutely allowed them to name it. Some of them mentioned scared. Some of them mentioned angry. Some of them mentioned confused. Some of them mentioned several things. Once you gave them the opportunity to name it for themselves, because the only person who can really name their trauma is the person who's experiencing that, right? So once they had the opportunity to name it for themselves, we had the opportunity to engage in a conversation about, well, what does that mean? And what could we do about it? What would you like to see change? And once they had that opportunity to feel as though they were on a level playing field with whoever was in the room, because in this room there were judges, there was some law enforcement, some educators, they actually were able to talk through it and come up with their own ask. And having that ask, it empowers them to say, this is what I'm feeling, this is why, and this is what we feel like needs to happen. And they walked away from it with wanting mental health counselors in their schools, which they did not have. They wanted cultural competency and implicit bias training for their law enforcement officers who were in their schools, which they did not have. They wanted mental health training for the teachers in the school systems, and not just the teachers, right? The janitors, the lunchroom workers, the secretaries and administrative staff, because sometimes they might not talk to their teachers. They'll go talk to the janitor because they have a better interaction with them. So, so absolutely, yes, let them name it for themselves, and then let them talk through what solutions could look like for themselves.
Right, so I think it's not only appropriate to name a thing, but it's absolutely necessary, right? And I think if we're gonna continue to name things, we have to say that much of what our young people are experiencing now is a consequence of how we messed up. As the consequences of a society that we have built for them. And so that's the thing too. And so we have to acknowledge our complicitness in what is before our young people. They have more access to information than ever before. And that's not always a good thing, right? Sometimes too much information, too much access, being able to see every violent act against people, in your pocket, on your phone, things like that. That's traumatic. And it's a trauma that many of us didn't have to particularly endure during those times just because we didn't have access to so much information. And so it's not only appropriate, absolutely necessary that we name a thing, and we have to take responsibility for how we have contributed to that thing.
Let me take her question and then we'll
Okay, I'm going to sit down.
Okay.
So in the spirit of Mr. John's comment to make this inclusive space of young people, I'd ask each of the panelists maybe to speak to or respond to how do you, with your organization, reach the next and younger generation, whether with social media or different messaging? What's your strategy to address those who are coming behind all of us in this room?
Yeah, why don't we go down? We'll start here and go down.
Absolutely. So we are really, really clear. So we work with mayors, and we ask them to put together a table, and we're real clear that table has to have young people at the table early. And often, and we help train those young folks, give them the skills that they need so that they can be an advocate for them and their peers on the ground. We're also in the process of creating a Young Leaders Fellowship for young folks 18 to 24, especially those young folks who are directly impacted by violence on the day-to-day, and having them become part of our leadership team so that we make sure that we have the right, we're moving in the right direction and the right solution. But for us, it's real clear, we can't go work in a city if the mayor and their team are not having young people at the table. Their voices is just as important for the mayor's voice for us. So that's how we usually work. So that's how we push it and make sure that young people are always at the table.
Yeah, I think we have to constantly evaluate how we're reaching our patient population. What worked for folks back in the day will not work for folks today. We need to understand what our young adults are looking for, what speaks to them, and what works for them. So we have sort of evolved many of our offerings so that it's more accommodating to them, whether it's digital offerings, whether it's mobile app offerings, online resources, ways for them to get their healthcare maybe in a more convenient way, maybe in a more discreet way, one that using a way that's more technologically advanced, and making sure that we appeal to folks like that. We have a rewards program, we call it Balance Rewards and Help for Healthy Choices, and it's actually a very interactive way for our patient populations to just get excited about their health. So folks will get points and certain rewards for checking their weight daily or for logging in their food and calorie consumption. If they decided to stop smoking or things like that, so they get points and they get rewarded and they get excited about it. And it's a fun way for them to be engaged in their health, and they do make very different choices as a result of doing these things. I'd mentioned our It Ends With Us campaign earlier, and it is sort of written by young folks, it's presented by young folks, delivered by young folks. They understand what people are going through, and it helps connect that message. So it's certainly important to us, for us to, and all of us, to just be aware of our population, what their needs are, how their needs are evolving, and let's adapt to that.
Much of No More Martyrs is driven by the ask of the community. So we do have an ambassadors program where young people can come in and tell us what they feel like they need to see in regards to getting the information out. And I joke a lot of times even with social media, the reason we have an Instagram page is because a young person came to us and said, "You don't have an Instagram page?" And I was like, "We don't need Instagram, we have Facebook." And they said, "Well, Facebook is for old people." And I was like, "Wait, what?" So really, I know, I kind of felt some kind of way about that too. I was like, what? I'm always on Facebook. But listening to young people and then empowering them, by empowering them, they're empowering us. Because we're really just trying to get the word out. We're trying to normalize the conversation around mental health, and empowering them by saying, hey, write for our blog. Hey, help us put together our summit. Hey, speak at our summit. Because there are young people who are doing phenomenal work in the high school level, at the university level in regards to mental health and activism. And so saying, we're going to celebrate you and your work we want you to come do a workshop at our conference. So really, by empowering them, they're empowering us, and we're getting that message out further. So young people have a lot of power and potential. They just need a platform.
Show of hands, how many people have an Instagram account?
I do now.
Awesome. Okay, those who do not have your hand up, look to the person next to you and ask them to hook you up. Yep.
While we're taking polls, show of hands, how many people have mentored a young person not in your family bloodline? Raise your hand.
Oh, yes.
Okay, so mentorship. So we partner with a mentorship program, Grip Outreach for Youth, of which I've served the last 8 years and have been a member of their board of directors for the last 4. And so we do what we call walking life on life with young people. It gives you direct access to their lives, to their experiences, and to their voices. And so mentorship has been a tremendous platform, a tremendous avenue to really be able to engage young people, but we have to be intentional about it, right? And it has to be very personal and not so much professional. There's a young man who I've walked with for the last 4 years who was perinatally infected with HIV, had never publicly disclosed his status. And over the time I remember when he told me he was HIV positive, I can remember she was shaking and he sat down, and I already knew because I had a conversation with his mother, but I never disclosed that I knew his status. And so when he was comfortable sharing it with me, he was so terrified, he was so horrified. And that was 4 years ago. This past January, for the first time, he stood before an audience and publicly disclosed his status because he was ready and he wanted to be able to raise awareness. But that was a direct result of mentorship and me walking alongside him, being willing to give him space and freedom to be able to share when he was ready. And as a result of that, he's now more engaged in activism, in youth and HIV and AIDS movement, and he's educating others within his peer groups. And so mentorship would be my recommendation for the best access to young people and engaging these issues.
So I want to say thank you for walking with him, and to each of you for doing this work on behalf of our babies. I taught kindergarten and third grade, y'all, so I call all of them babies. But in that spirit, I'd like to invite you, and then again, as we wrap this up and land this plane, to offer up a young person, right? So if appropriate and comfortable, is there a young person you can name? Maybe they have a Facebook page that some of y'all can access. But just let's invite them into the space. Maybe you want to lift up someone.
Sure, Richard Atkins.
I'll mention two who are no longer with us, right? So Caren Washington, who was the founder for Brown Girls, and that was a blog on colorism, and she spoke very openly about her depression and her anxiety. We lost her to suicide in 2014, and that's actually how No More Martyrs came about. Her story was something that was so moving to me. But also Michelle Shirley, who was recently killed by police in California. And she was a recent law school graduate who went into distress. She lived with bipolar, and she was a mental health advocate, and she was shot and killed while in distress in public behind driving a vehicle. And the reason I would like to highlight both of them is because they were young, but they were also educated and successful, contributing members of society. And I say that because I think a lot of times when we're thinking about our outreach, we're thinking about individuals who are, somehow not educated and not successful in their lives and not, advancing in thetheir careers or their education. And so we look for someone who maybe has a mental health concern, and we don't expect it to be a CEO of a company. We don't expect it to be, a high-achieving person. One of the things I say, especially in the university and high school setting, if there is a young person that is excelling in sports, the president of every student organization, doing volunteer work on the weekends, straight A student and accepted into numerous universities or something along those lines, that's someone you might need to engage in regards to mental health. It's not always going to be that person who's failing out of every class. And so I lift up Michelle Shirley and Caren Washington.
Thank you.
I'll add a young guy from Durham, North Carolina, Can Reed, is Jay, Can, C-A-N, Reed, R-E-I-D. He's an amazing young documentary. He's out there doing a lot of documentaries, and he's also doing some amazing podcasts. And he's really been helping us elevate our voice and also help other cities work with young folks. And then I'll also offer up Burley, who's been doing some amazing work across the country around his advocacy work, and she's out of Philly. And the last one I'll do, David, is Alex P.A. out of Philly as well. He's doing work in Philadelphia and in California, but really trying to make sure that he's really there for his child. He's got a daughter who lives in California, and just really spending time there too, right? So again, young folks are doing amazing stuff, and I could probably go on down the list, but those are the three I'll offer up. Yep.
As a healthcare provider in true HIPAA fashion, I won't name a name, but there's a lot of names, a ton of kids, both here domestically and globally, that are dying from vaccine-preventable diseases that are so easy to get for us out here, and are dying from vitamin deficiencies that are so easy for most of us to get and receive. It's amazing and stunning to see how many kids do not have access to these products. And so two programs that our company has embarked on for the last maybe 5 to 7 years, it's called Get a Shot, Give a Shot. When folks come and get an immunization at our store, we donate the cost of a vaccine. And it's a vaccine that's actually killing the kids in those countries. So we're making sure that they're getting the right things that they need. And then also when you purchase products, we also donate to providing vitamins for folks both in this country and abroad that are deficient. So there are many kids around this world that are suffering for really no reason. And so we have ways to do that. Let's all kind of band together to make sure that they're taken care of.
Appreciate that. So Nadia reminded us of the importance of shifting, right? Really focusing on preventative care and addressing persistence and calling a thing a thing. Ulysses reminded us about the importance of considering social determinants and putting people before their problems. Charley reminded us of opportunities to make sexual health education exciting and health and wellness more generally exciting. And Anthony talked about the importance of spending time telling our stories, but doing so in ways that honor the truth that we sometimes think that we have to hide. I want to add one thing to that list, and it's to think about doing a version of this conversation with the young people that you know and serve. The thing I'm most proud of, and the time that I had to support our country in service to, again, still my forever president, his fabulous First Lady, Michelle Yvonne Robinson Obama. Sasha Malia, Sonny Go, all of them. Still my president. That's how I deal with my trauma. I go back to that place. That's my Wakanda. Right? The thing I'm most proud of is having established what we call AFAM Ed Summits. They were produced at colleges and universities around this country, historically black colleges, predominantly white, 2-year institutions, 4-year institutions. And the one rule that was non-negotiable is that the only experts who got to sit on stages like this and talk in front of the White House seal were literally our babies. Children in elementary school and middle schools and high schools and on colleges, campuses around this country. And no matter where we went, we asked them one question. I encourage you all to write it down. Please take it and ask the young people you serve. What do you need in order to thrive? Too often we spend time thinking about just addressing the surface or making it so they're just okay enough. And a part of what I hope we're able to do, and I'm thankful for platforms like this because it helps us, is to shift to a space where we think about what's possible when our babies have all of the support they need in order to thrive. The answer to the question that we most often received, one word, 4 letters, love. We sometimes bend over backwards thinking about new programs and projects and like the work has to be creating something that hasn't existed. And the thread through all of this is that too often our babies and the challenges they face, sometimes our babies on the way to and from school face challenges that would break the average adult. And it often goes unacknowledged or missed. They show up in classrooms and we care about, did you do your homework? Not did you have a home to sleep in? We ask them to perform and show up and show out and seldom ask them, right, are you okay? So I just want to affirm the work that y'all are doing in this space. Again, bringing in the spirit of Dr. Angela, who said y'all are going to forget most of what we said. But hopefully you will understand the importance of being able to lead with love. Thank you, thank you, thank you.